Good afternoon, everyone, and thank you for joining us, for those here in person and those joining online. We are here at the Convention Center in Doha at the summit, where I understand around over 14,000 people are in attendance. Over 40 heads of state spoke yesterday, were here yesterday. Around 170 ministers from 173 member states. That's one, I think the summit has already succeeded just by this in bringing us all together. It is my pleasure to start a solution spotlight from trends to transformation, anticipating and acting on global population aging. And what I love most about it is the variety of the sectors to which our panelists come from here today. We have our colleague Jassim Al-Hamrani, Mike Hoden, Heidrun Molenkoff, and Gregor Sneddon. And I want to pass it on very quickly to all of you, starting with Jassim and moving to my left, just to quickly introduce yourselves to the audience.
Thank you, Amal, and a pleasure to be here. My name is Jassim Al-Hamrani. I'm the Director of Strategic Planning and Communication at the Executive Bureau, Council of Ministers of Social Development and Labor at GCC states.
My name is Heidrun Molenkoff. As you can easily hear, it's a German name, so I'm from Germany. I'm member of the board of BAXO, the National Association of Senior Citizens Organizations. I am also president of Age Platform Europe, the largest European network of organizations of or for older persons. And I am representative of civil society to the Standing Working Group on Aging at the UN ECE region. Thank you.
Thank you, Amal, and nice to see everyone. I'm Mike Hoden, founder and CEO of the Global Coalition on Aging. It's the global business voice dedicated to improving the world through the aging lens, recognizing that this megatrend is exactly a trend that needs profound transformation. Thank you.
Hello, colleagues and friends, friends at home. My name is Gregor Sneddon. I'm the Secretary General of the International Federation on Aging, the IFA, and we drive a global sectoral collaboration for healthy aging and longevity. We're based in Canada, work globally, and glad to be here.
Wonderful. Thank you all for joining me. Jassim, earlier today in a solution session, the GCC launched an Older Persons Wellbeing Index, which I saw from the looks of some of the audience came as a surprise, knowing that the countries that you represent are quite a young population. What are the main insights of this index, and how can governments in your membership use it to better shape policy?
Thank you, Amal, for the questions. The first thing that we ask ourselves when we decided to launch the index is, what are we measuring? As you know, that the aging ecosystem is a complex. We cannot just focus on one aspect without the other one. So basically, the index is focusing on 5 pillars, which is the health system, how we can make it an access and quality of care. The other one is the financial well-being, the security, income, and economic participations. The third one is the social well-being, which we are talking about the community connection and safety. And the fourth is the enabling environment, how we can create an enabling environments in the GCC, which is the social and physical structure that we have in our societies in GCC. The fifth one is the empowerment and active participations. Those are the 5 main pillars that our index is built on. As I mentioned earlier in the sessions, we are still in the phase number 2. We hope to see the index being completed, hopefully by the coming few months. We hope so. Yeah.
This is very exciting, and we can't wait to see once the data starts compiling and the analysis, what it will tell and how it will shape decision making. Hydran, you bring both the researcher's perspective and lived experience to this conversation. I want to tell you all that for days now, I've been struggling to ensure that Hydran, who just spoke at the solution session quite a distance away, would be able to make it here in time, just to show you that I lead the program on aging, and still I have to let go of some ageist stereotypes that I do have, because Hydran made it to this room before all of us. How can we better, in your view, connect evidence and lived realities so that policies truly affect people's needs across the life course?
Well, as a sociologist, I'm of course interested in all the aspects you mentioned for your index, and I think all of them are important. What I always use or try to use or have tried to use is both good statistical data and qualitative data, and to try to combine them to get the view of the people you are dealing with and to get more of the context. Why do we get this kind of figures, for instance? So in that case, I think it is easier to translate the findings of science into real concrete policy measures when you know the background of the answers and the stories of the people.
Wonderful. Thank you, Hydran. Mike, your coalition has businesses from finance to pharmaceuticals, health, banking. From that perspective, how is the private sector using data on aging to innovate across health, finance, and technology?
There's, I would say, three common themes that all of our companies and sectors generally apply when they have a strategy around aging. One is elder caregiving, which is critical for society. It's important from a workforce point of view, and it enables greater productivity oftentimes. A second is related to that, workforce change. That there is the idea of more productive and healthier workforces in the context of aging societies are going to be ones that are intergenerational and multi-generational. That just because you're 78 or 28 doesn't mean you shouldn't be working, and doesn't mean you shouldn't be working together. So all of our companies have that kind of theme. A third theme, which is related to that, is the interest in preventive health. Now that's obviously the case for those who are literally in that business, let's say a GSK or a Pfizer or a Novartis. But it's true everywhere because it's the recognition that in an aging society, we have to shift from the 20th century model of acute care, where we basically deal with disease or health problems at that time, to preventive health, so that it can be beneficial in the case of employers to their workers, but also be excellent for the marketplace itself. Thank you.
Very interesting. Thanks, Mike. Gregor, I heard you say earlier today that from civil society's perspective, nothing about us without us. And it was such a treat to see you be one of the first speakers from the floor yesterday in the round table, which was one of the formal meetings of the summit. How, in your view, from the perspective of civil society, can advocacy help ensure data and research translate into action on the ground, particularly in countries where capacity and awareness remain limited?
Well, from a civil society perspective, we would say, advocacy turns research into action. It's the advocacy engine of it translates knowledge into movement. So, for example, MIPA the Madrid International Plan on Aging, Action on Aging, would suggest that data and research must serve dignity, security, and participation. But 20 years on, we're coming up to the 5th review. Research is advancing, but there's still, policy is uneven, especially where capacity is limited. And we face, technology is advancing at such an incredible pace. I mean, we may be able to say within this year alone that Alzheimer's is both preventable, detectable, and treatable, but only for a few. And so how we face a significant equitable policy infrastructure gap, and we do not have equitable systems yet in place to keep up with some of the great news that we're facing on aging. So advocacy helps to bridge that gap. It makes data human, actionable, and accountable. And I would say there's 3 areas in particular. So it translates evidence into human stories. So it makes evidence real, data, meaning, and movement. It links stats to real lives so that we're not just shelved statistics, but we can see the application and interpretation from real lived experience. It builds participatory accountability. So civil society, it should be shaping research, and it validates findings, and it also demands transparency. And it includes older people within the actual frameworks and decision making. And finally, it fosters intersectional action, because we can't do this without partnership. It connects the dots between research and those policy levers: labor, health, urbanization, social protection, and it helps convene those partners to co-design the solutions together, because it's only together that we'll be able to advance this policy forward.
Fantastic. So it's clear that data gives us direction, research gives us depth, innovation gives us scale, and advocacy drives inclusion and equitable access. So let's explore how these connect in practice. Jason, the GCC has shown strong collaboration across ministries of labor and social development. What lessons can others learn from your model of policy-driven cooperation in the Executive Bureau?
I'm not going to say there is a lessons that we can spread it here, but it's there is two things that we can point it out here. The first, within the GCC societies and their economies, there is some kind of similarities. For example, the shifting demographics is one of the examples that the GCC, the 6 countries are facing. So that's a little bit make our life a little bit easier in terms of if we want to initiate a new policies or something like that. And the other thing is there is a willing from the leadership that we want to achieve. We want to unite on a shared goals within all these GCC countries. The second thing is we move from dialogue to co-creations. If we want, for example, the launching of the index, it's something that we want to present it on the ground, on the real life. So I think these 2 things, it's if we can say it is a kind of lessons that we can show it to others. I can just point it in these 2 things. Yeah.
Fantastic. And this is part of the beauty of the review and appraisal of implementing MEPA, that it has that bottom-up approach, starting nationally and regionally and then globally. And a lot of the amazing stories come from that regional cooperation. Mike, in the hallways here, inside the rooms, we've heard it, aging is one of the most predictable megatrends. Are businesses aware of that, and what does it mean, in your view, for investors, for employers, and innovators?
Yes, great question. They're beginning to get it, and we think the opportunity is far greater than is fully recognized. The companies that we see that are getting it, a Bank of America, a Novartis, Uber, a Philips, they will have strategic planning groups, strategic planners, oftentimes part of the C-suite, and one of their jobs is to look out 3 years, 5 years, maybe a little bit longer, to understand what the opportunities are and to innovate and compete based on that opportunity. Those who are getting it are looking at this $22 trillion silver economy, which, as I've said in the past, I think is understated, underanalyzed, but trillions that is growing all the time, and see a market opportunity and then build plans against that. And inside that 22 trillion, they will see two of the larger trends. One is that we are realizing longevity, thankfully, around the world. We want to achieve a healthier longevity. But the 2 billion of us on the planet over 55, doubling by mid-century, is a marketplace that any company interested in revenue growth will look at. But secondly, they will also understand and realize the other trend, which more and more are doing, namely the low birth rates, which are happening in every society as it modernizes, everywhere in the world, including right here in this region. And the result is more old than young. And so if you're a planner looking out 3 years, 5 years or more, you will see not only a very significant market opportunity, which with a huge amount of needs that you can fill through innovation, but you will also see that that is the marketplace which is the growing one, more old than young. Our children's children may begin to make babies again, but for the next 30 or 50 years, that's how demography works. And so we have an older society globally, and therefore a huge opportunity where innovation and people's needs for a healthier aging can be met in part by the private sector.
Interesting. Hydran, Mike makes it clear there's a part that's self-interest for businesses to lean into this conversation. I wonder what the self-interest is for the research community. Today, you know, we've launched the initiative in partnership with Mike and Gregor to update the UN global agenda on research. What, in your view, are the priority areas most urgently that needs attention for research?
Yeah. Explicitly, when I hear you talking, I think from research we know very well that it is only a part of the older population which is able to spend this money for silver economy, and that we have a large share of the population in many countries who are not able to do this. And I think to show the differences is one of the main tasks of research, of scientific research. That we do not take averages because they hide the differences between the upper and the lower population groups. And also the question of solidarity between generations. It is not just a question of generations. It is a question of social class, because within the older population we have well-off people who can afford and profit from all the new developments of assistive technologies, for instance, and those who are not able. And also among the adult and the younger generations, we have enormous differences among them among the age groups, among countries, and among the regions of the world, of course. And I think this is one of the main tasks of research, to show the differences and to suggest solutions for specific areas and specific topics and challenges.
Thank you, Heidrun. It's very interesting you say this because we know that life expectancy at birth, if you look at the country with the highest and the country with the lowest levels, there's over 3 decades of difference. Meaning if a person is born in that country with the lowest life expectancy, that child will miss out on 30 years of life just because of where they're born. And we had mentioned earlier today that next year we look forward to the Human Rights Council in Geneva is establishing a working group where they will be elaborating an international legal instrument. This is an interesting approach to help balance these conversations because it sets normative standards that every country could look up to provide the bare minimal to close those gaps that you have brought up. And Gregor, this is where the voices of older persons really matter. In your view, how could civil society help bridge global commitments and local implementation to ensure that policy change reaches communities everywhere?
Yeah, that's the great question. How does civil society bridge local promise to local progress? Well, I'd offer three ways that we do this. One is localized global frameworks. So for example, MIPA has its vision of a society for all ages. So how do we translate that vision into the local community? So one is that CSOs, civil society, can align community priorities with these global frameworks. That's really key, to be able to have a two-way conversation of where they overlap and how the language can be shared, both from a data inclusion, but also in the way that we advocate and work together. You know, thinking about things, even like the policy frameworks now around smoking. Much of that was fueled by socialization at the local level that was so important for that two-way dialogue, just as an example. The other one would be co-producing solutions and, most importantly, building partnerships. So it's the implementation of like multi-stakeholder and multi-generational collaborations that is going to make this. The only way it's going to work is if we're working together. It's not siloed into individual sectors. It's a system. It's government, academia, and private sector. We need each other. We can't, none of us can do it alone. And finally, it would be ensuring accountability and continuity. So for example, the MIPA review every 5 years, will CSOs fill the space in between, track delivery, tell the stories, make it alive and real, so that it's, you know, not just a report. Not that it's just a report, but it keeps it alive between reports within community at the local level, which is really important for that, for that energy and movement of policy and advocacy.
Fantastic. I mean, this shows the complexity of dealing with this topic, looking at government, research, private sector, civil society. And I think in our view, when we deal with member states and help inform them so that they could make those decisions, the demographic context is also quite complex. And I often ask people, when you think about aging, which countries do you think about? And a lot of time they mention Europe or Japan, whereas you look at the total number of where older persons live, that is not the order. In fact, Germany does not show up until the top 8 countries. So you start off with China, followed by India, followed by the US. And then you need to look at the share of older persons in comparison to other age groups. Then you need to look at when people hit that arbitrary number of 60 or 65, how furthermore are they expected to live? In Canada, I believe it was 26 or 28 years beyond, and that also has to go into the thinking around this issue. So this is where we're very excited about launching this research initiative next year to have the academic and research institutes lean into it. Thank you all for a really wonderful discussion. As a final roundup to our conversation, if you could name one lever one lever to make societies ready for population aging and for longer lives. And the levers would be, based on our discussions, stronger data, smarter policy design, or stronger partnerships. Which lever would you pull first and why?
Actually, I see all are interrelated and interconnected. But if I'm going to choose one lever, it will be the data. If we don't have the data, then we will not be able to initiate any kind of policies. So I think the data will be the first. I don't know if you agree with me.
No, I think the data alone don't help. You need people who translate them into action. So for me, it's the partnership between all of us.
Yes, they're all very important, but I would choose partnerships, but I would say trusted, partnerships based on trust. And it is that trust factor that we see evaporating all over the world. And so partnerships based on trust.
I'm afraid, my brother, it's 3-1. I'm on the partnership side. Aging, it's as we know from the Doha Declaration and MIPA, that aging, it's not a sector, it's a system. It's a system, and it requires partnerships that makes the data shareable, it makes research usable, and it makes policy co-created. So government, civil society, private sector, and older persons themselves have to be involved, even in all of those areas, including the research. So it makes data actionable, it makes policy human, and it makes innovation inclusive. So that would be mine.
Fantastic. And if I would take advantage of moderating, the demographer in me would be with Jassim. Like, I want data. But after the lived experience of working in the UN for so long, I would say at this point, it's all hands on deck. If you're doing it, we'll take it. Thank you so much for being with us today for a fantastic discussion, to the audience and to everyone watching us online. Thank you.
Thanks so much.